All right. First question, and please keep your questions very short as we're limited on time. Brenda Goodman at WebMD.
Hi, I'm just wondering about the timeline for implementing the president's plan, especially the emergency rule at OSHA. How long is that expected to take, and how long will it be enforced? And then also, what is the ultimate goal of this new plan?
Well, I think in terms of the ultimate goal, it's to accelerate our path out of the pandemic, to get as many people that are not vaccinated as soon as possible, to safely keep our schools open, our economy continuing its recovery, and to decrease the number of hospitalizations and deaths from COVID. The Secretary of Labor will oversee the rulemaking process with OSHA. We anticipate that that'll come across the coming weeks, and then will be implemented for all employers above 100 employees. The need to get vaccinated or tested a minimum of once per week. Next question.
All right. Next question, Lauren Hirsch at the New York Times.
What is the punishment for companies that do not abide by the vax or test rule?
So this again applies to companies with greater than 100 employees. And if a workplace refuses to follow the standard, the OSHA fines can be quite significant. Enforcement actions can include fines up to $13,600 per violation. Next question.
Monica Alba, NBC News.
Thank you so much, guys. The question is, once boosters do become available in 10 days or so for those who got Pfizer as expected, what will be the standard for fully vaccinated? Will it be 2 doses or 3 doses for those federal workers and contractors in particular, for whom the 75-day clock starts ticking as of yesterday?
Dr. Walensky.
Yeah, thank you, Monica, for that question. We have posed and will pose that question to our advisory committee on immunization practices. Currently, fully vaccinated is 2 doses of Pfizer and Moderna or a single dose of J&J. I anticipate over time that may be updated, but we will leave that to our advisors to give us some recommendations.
Next question.
Let's go to Josh Wingrove at Bloomberg.
Hi there. Thank you very much. Can I just ask broadly, yesterday was focused on employees, essentially. Many of the deaths are still among the elderly, who of course have the highest vaccination rate, but are still bearing the brunt. What, if anything, can you do, or are you considering doing, to try to fuel vaccinations among that sliver of older folks who haven't gotten the shot? And separately, have you ruled out whether you would ever do a vaccine requirement or testing requirement for domestic flights, or is that something that could still be possible in the future? Thank you.
Dr. Murphy, do you want to start with the first question on the group that's 65 and older, where vaccination rates are quite high, but obviously we want to drive them even higher? Dr. Murphy?
Yeah, that's right. Well, thanks, Josh, for the question. You know, it's important folks know that we've got over 90% of seniors with 1 dose of vaccine, more than 80% who've gotten fully vaccinated. That's good progress, but we want to get as close to 100% as possible. You know, I do think to continue to extend the protection seniors have, that the boosters will likely be helpful in the end. That's one of the reasons we came together as a medical team from the Department of Health and Human Services and laid out that plan last month, which will be contingent on FDA and CDC guidance. But we're also continuing through our community core efforts to reach out to seniors. You know, we know that every senior matters in terms of getting them vaccinated. That's a potential life saved. And so the vast network of community organizations, which include doctors and nurses, faith leaders, and other community organizations, has been absolutely essential in doing that outreach. And we're going to continue to do that in the months ahead.
Josh, Jeff, if I might just add to that, the mandatory vaccination for our long-term care facilities, for our dialysis centers, for places where these elderly people often interact in our healthcare workforce, we've seen that makes a difference. And so I anticipate that'll make a difference as well.
Thank you, Dr. Walensky. So Josh, on the second part of your question, which I believe was about airlines, first, the vaccination requirements that the president laid out yesterday will affect about 100 million American workers. That's 2/3 of all workers. So we're taking strong action on vaccination requirements. And we believe that workplaces are a very efficient and effective way to ensure that people get vaccinated or at minimum get tested one time per week. And verifying in the workplace that someone is vaccinated does not place an ongoing burden on vaccinated people. As to travel, we're taking further action, as you know, to double the fines for non-compliance of masking on airlines. So that's a TSA action that was announced yesterday. And overall, I think we have a very strong track record that shows we're pulling available levers to acquire vaccinations, and we're not taking any measures off the table. Why don't we do one more question, Kevin?
Last question, Sasha Pezenik at ABC News.
Hey guys, thank you for taking my question. For Jeff, as much of the COVID response has been in states' hands, I'm curious how you'll enforce the new mandates that President Biden has now put forth. If we're seeing that so many GOP governors already have pushed back. And then for Dr. Walensky, do you have an update on what percentage of people in the hospital are unvaccinated? Last we heard, your overall estimate was about 97%. If there's any update on what the new estimate might be, that would be very helpful. Thank you.
So Dr. Walensky, you want to do the second part?
Yeah, I will just say that this, of course, changes over time and by jurisdiction. As we have more and more people vaccinated, and with the Delta variant and seeing waning, we are seeing more people in the hospital who have been vaccinated. But what I want to reiterate here is it's still well over 90% of people who are in the hospital are unvaccinated. And as our MMWR states and I highlighted, we still have more than 10 times the number of people in the hospital who are unvaccinated compared to vaccinated.
Yeah.
Jeff, can I add one broader point once you're done?
Please. No, please.
Well, I just want to say to the broader questions, about seniors and kids and how do we protect them, these measures that the president announced yesterday, particularly with regard to workplaces, are a really important part of actually protecting seniors and kids, even though they may not be in the workplace in larger numbers. And here's why, because we know that the key to reducing transmission is getting more people vaccinated. And even if you're young and relatively healthy and you're not worried about the consequences to yourself, you could pass the virus on to other people. And that's why this collective responsibility we have as a society to make sure we are not only taking care of our own health, but reducing the chances we pass the virus on to somebody who's more vulnerable. That's why this is so important. And that's what the efforts that the president announced yesterday will help us do: reduce transmission, protect lives, and protect our children as well.
I think it's a good transition to the last part of the question, which is from day one, the president has been clear that COVID, the pandemic, is a public health issue, not a political issue. And that's how it's been addressed. And the president has been clear that he will not hesitate to take strong actions like he did yesterday to protect workers and the American people and accelerate our path out of this pandemic. We know that vaccination requirements work. We see significant increases in vaccination rates at companies, healthcare systems, universities that implement vaccine requirements. When Tyson's Food announced to its employees that they would need to be vaccinated no later than November 1st, at that point, only 45% of the workforce at Tyson's was vaccinated. Now that number is over 72%, with many weeks to go. At United Airlines, when they announced the vaccination requirement a few weeks ago, since then, more than half of its unvaccinated employees at United have now gotten vaccinated, and they still have weeks to go before their deadline. So vaccination requirements work. And that's why so many organizations have come out in support of the president's plan that he announced last evening. As I mentioned, the Business Roundtable, the American Medical Association, and importantly, local on-the-ground public health officials have applauded the president's plan. So let me also remind you that vaccination requirements are the current standard employed by so many corporations. The president's actions will accelerate that number of companies across the board for employers over 100. And that includes Fox News, which already has that vaccination requirement in place to keep its own employees safe. So thank you for today's briefing, and we look forward to seeing you next week. Thank you.